Are you struggling with PCOS and trying to figure out how to navigate fertility challenges? Or are you just feeling lost and not knowing where to start? In today's video, I'm going to talk all about PCOS management and ways that you can improve not just your hormones, but also your chances to have a baby if that's what you desire. Remember, you're not alone. PCOS affects many women, and with the right support and information, it is possible for you to be able to manage it. So let's jump right in. The first thing is that PCOS, it is a condition of several symptoms that produce a syndrome. And what happens is usually you are unaware that you are dealing with PCOS, but it starts to cause a lot of issues throughout your body. And in particular, it can be an issue of infertility. The ovaries, they start to produce a lot of androgens. These are those male hormones like testosterone. And when these get produced, it actually can cause you to have irregular periods or just complete absence of ovulation. And of course, if you're not ovulating, this makes it extremely hard to get pregnant. But the good news is that there are different ways that we can manage and balance the hormones in our bodies to be able to have regular periods once again. Two of the key factors that impact our body is insulin resistance and irregular periods. So with the irregular periods, like I said, it's those androgens that are causing the issue with not being able to ovulate. And when we're not ovulating, it's not producing a menstrual cycle. So this can happen from when you are a young age, as a teen, all the way into adulthood. If you are someone who's noticing that you're having irregular periods, this is just one of the symptoms. It could be other things. However, it is just good to have the awareness that with PCOS, that is one of the key symptoms. The other thing is that you develop insulin resistance. So our body becomes more sensitive to insulin. And if we aren't able to balance the blood sugars in our bodies, this is going to put us at risk for conditions like diabetes and heart disease. Of course, when you go to your doctor or medical provider to get checked out, they are going to do different tests. And some of the tests are going to be blood tests. They're going to check your hormone levels. They're going to check risk factors for those conditions like diabetes, heart disease. They'll also check a pelvic ultrasound to see if you could have cysts on your ovaries. So with polycystic ovarian syndrome, one of the factors is that on ultrasound, typically you would see a lot of these cysts or follicles in the ovary. And so this can be a classic sign that you might be someone who's struggling with PCOS. Of course, if you are someone who does get this diagnosis, it's not easy. It's definitely taxing because it's an emotional roller coaster, right? You are dealing with the symptoms already, and then now you're trying to figure out, how do I manage and control this condition? And if you are struggling with infertility, it is probably one of the reasons why you're not able to get pregnant. So it's a lot to carry, trying to figure out what is the best remedy and if there's even a possibility of being able to correct the condition and balance your hormone levels. So you might be somebody who is tracking your menstrual cycles, for example. You might be changing some lifestyle habits like what you're eating and levels of exercise. Those are all great things. So it's totally normal to feel overwhelmed. I definitely dealt with that when I was trying to initially start managing PCOS. But the thing to remember is that with the right support, you can control the symptoms. It is possible to heal PCOS in your body. It is a lifelong process. So once you get the diagnosis, it's something that you're going to have to manage throughout your life. But with the right tools, you can do it. And just remember that no two journeys are the same. So even if you and a friend or someone you know has PCOS, it's gonna look different. It could show up different. You guys might deal with different symptoms. But again, knowing your body is the most important thing so that you can try to find ways to be able to help yourself. So let's dive into the medical treatments that are used for PCOS that can really help to balance your hormones and support fertility. The first is Metformin. Metformin is a medication commonly prescribed. It is used typically for diabetics or people that are dealing with prediabetes because it helps manage the insulin resistance. So it helps you by just balancing out your blood sugar, keeping you from having those high spikes, making sure that you are able to lower blood sugar levels. This is extremely important. So it's not a magic pill where if you take it immediately you're going to get pregnant. It could take several months for your hormones to become more balanced, and then you will notice that you're starting to have your periods regularly. And this of course increases your chances, because if you have a period, you're ovulating, releasing that egg, and it's more likely to get fertilized. So Metformin is a great medication. The next medication is Clomid. Clomid is typically used for folks who are dealing with infertility because it stimulates ovulation. And so if you are somebody who has still had issues trying to conceive, you've tried to get pregnant, it's not working, maybe you've taken metformin or you've lost weight or you've done things, you still have not had those regular cycles, Clomid will help because it makes your ovaries release those eggs.
Hey guys, so as I was doing these post edits, I realized I forgot a really important medication. So along with Clomid, the one that's actually used more often is Letrozole, and it's because it has less side effects. So Letrozole, it was originally used for breast cancer treatment, but it's a medication that can stimulate the ovaries as well to produce eggs so that you will have ovulation in those regular cycles. And it's great because it has less side effects. You don't have the risk of multiple births as much. I think it's like 1% chance. Whereas with Clomid, it can be like 5 to 10% chance of you having twins or even more. So Letrozole is a great option. Also, it helps because you won't have the risk of a really thin endometrial lining, and that can happen when you do use Clomid, and it just makes implantation a lot more difficult because it's too thin. So Letrozole, if you do need a medication like this, it would be offered first over Clomid. And then of course, this video is for women who are hoping to have a baby, right? But if you are just somebody wanting to manage PCOS and you're not actually trying to conceive, a medication that will definitely be offered is hormonal birth control, because if you have that combined contraceptive with estrogen and progesterone, it will definitely help you to have normal menstrual cycles, and you won't have to worry about having high androgens because it will lower that as well. So it's a remedy if you want to be able to have regular periods. Of course, you definitely want to keep doing those lifestyle factors. Like I said, the medication is not just a cure-all. You really have to work on treating the root of PCOS. So these things all together will help you have the best chance of conceiving. And then, of course, if you're not trying to conceive, just making sure that you have overall really great health. All right, back to our scheduled program.
The other treatment that is often utilized is IUI, or intrauterine insemination, and this is a procedure. It's in office where they will use actual instrumentation to put sperm directly into the uterus to help the process of fertilization. This is something that can be used kind of in conjunction with the medications. It's less invasive than in vitro fertilization or IVF, and it can be done with the fertility specialist as well. So of course, with managing PCOS, it's not just all about medications. It definitely is also about taking care of your overall health and wellness. And some of the things that you want to make sure that you are doing is changing the way that you eat and changing your physical activity if you are not very active, as well as managing your stress levels. So with eating, the biggest thing to remember is that you're trying to balance your blood sugar because of the insulin resistance. So it's really great if you can get on a low glycemic diet. And so all foods have a glycemic index, but the foods that I really want you to pay most attention to adding into your diet are like leafy green vegetables, more whole grains, berries, nuts, things that have a lower glycemic index, because when you eat these type of foods, it's not going to produce a sharp spike of insulin in your bloodstream. And so it's really, really helpful if you can have low glycemic foods throughout your diet. And then when you think about physical activity, having physical activity in general is just good for your overall health, but especially when you are trying to balance your hormones, it's important for you to have exercise regularly. It's recommended 30 minutes a day. This can be walking, some strength training, anything that's gonna help you get your body moving. You wanna mix cardio and strength. Those things together are gonna help, especially if you are someone who needs to lose weight as well. Making sure you're incorporating exercise is huge. It's going to help you feel better too with your mood. It's gonna help you drop some pounds if you need to, and it's gonna help balance your hormones. And then lastly, it's stress. Stress plays a huge factor for folks suffering with PCOS, because if you have high stress hormones in your body, these are competing with the other hormones. And so things that you find relaxing, whether that is taking time to meditate, pray, going for long walks, making sure that you are doing your exercise, whatever feels relaxing to you. If you have to go and get massages or find somebody that you can talk to on a regular basis, these things are really gonna help get your body in a place where you are able to have those regular periods. If you are not trying to have a baby, but you just wanna manage your hormones, this is still such an important thing that you need to have. So managing PCOS, it can be overwhelming, like I said before, but in general, these are gonna be lifestyle changes that will benefit you your entire life. Starting now and finding good rhythms, good patterns is going to benefit you the most. So if you found this video helpful, please give it a thumbs up and subscribe to this channel. I will give you more tips on fertility, managing PCOS, pregnancy, childbirth, and all of that stuff. So if you have your own PCOS journey, I would love to hear it. Please share in the comments. If you have any questions, you can put them in the comments too, and I'd be happy to answer those. I'll see you in the next video.